Tennis elbow or lateral epicondylitis is the most common injury to the elbow. It is a common musculoskeletal injury affecting both men and women equally, with a peak prevalence between the ages of 30 to 50. It affects 1 to 3% of the general population. Those at risk include tennis players, smokers, and manual laborers such as carpenters, plumbers, and painters. Tennis elbow is similar to other tendinopathies. It is an inflammation of the tendons that attach the forearm to the outside of the elbow due to overloading of the wrist and arm, which exceeds the tissue and tendon's work capacity. Most often it's due to repetitive motion and builds up over time. When the tendons are overly stressed past their capacity, it causes micro tears along the tendon, which causes inflammation and pain, which can impact work, leisure, and activities of daily living. Wrist extension, as shown here, is when the wrist is pulled back, similar to when stopping traffic. This motion, in addition to gripping and twisting motions, can cause pain. The condition usually starts by micro tears of the origin of the extensor carpi radialis brevis muscle due to repetitive twisting of the wrist. Physical therapy is supported in research as the best rehabilitation practice to improve patient symptoms. However, despite these benefits, the most optimal exercise dosage, including intensity, duration, frequency, and type of load for rehabilitation of tennis elbow, have not been established. Therefore, it is paramount to work with a physical therapist directly to design an individualized plan. First, we're going to start out with a stretch. The affected arm is going to reach out in front of us with the fingers facing down towards the ground. The other hand is going to come around, wrap, and pull the palm of our affected arm towards us. You're going to hold for 30 seconds for 3 rounds, 3 times per week. Hold the flex bar in the involved hand in maximum wrist flexion so that the knuckles face down towards the ground. Grab the other end of the flex bar with the uninvolved hand and face the knuckles up. Firmly grasping the flex bar, rotate so that they flip in opposite directions. Perform 3 sets of 10 repetitions 3 times a week. For the next exercise, the elbow is going to be bent at 90 degrees with the forearm rested on the table. The hand is going to be holding a free weight with the hand off of the table. Here, you're going to slowly turn your knuckles up towards the ceiling and then come back down to neutral for 3 sets of 10, 3 times per week. The next exercise is a resisted finger extension using a rubber band on the affected side. Begin with a rubber band secured around all 4 fingers and thumb. Gently spread your fingers apart and slowly return them to the starting position. Make sure to keep the fingers and wrist as straight as you can during this exercise, repeating 10 repetitions for 3 sets 3 times per week. With the affected arm rested on the table, with the palm flat on the table, you're slowly going to slide your fingertips in towards your wrist while keeping your wrist firmly planted on the table. And then you're slowly going to slide back out. You're going to repeat for 3 sets of 10 repetitions for 3 times per week.